Gaining access to life-saving medical care as a person with a rare disease can be a heavy burden. According to the patient advocacy group Rare Diseases South Africa, medical aid companies are taking advantage of inefficient appeals processes. The group claims this is being done as a delaying tactic to avoid funding life-saving treatments. Many patients with rare diseases sometimes wait for years to receive payment from their medical aid. Well, Rare Diseases SA CEO Kelly du Plessis joins me now to unpack this situation. Kelly, good afternoon. Thank you for your time. One would have thought you take out medical aid for these very instances where you need extensive and sometimes prolonged medical care that you otherwise would battle to gain ready access to in the public sector. So what are you saying? Are you saying that the situation is different for people who have rare diseases?
Yes, and it seems that for conditions where there is a need to access high-priced or innovative molecules or treatments, that there does seem to be a differentiating factor. And what we have found is that very often schemes use the delay process and the inefficiencies at the dispute resolution process, which is the Council for Medical Schemes, as a mechanism to save costs. Would be the obvious reason to do that, because if you take that, they can delay sometimes that process, or the process is delayed simply by the virtue of the fact that the council is incapacitated and doesn't have enough resources. The schemes have a significant cost saving in the time that those patients have not been funded. And unfortunately, the patients obviously are sitting in a position where they are not able to fund those treatments out of pocket while they wait for that process to be exhausted. So during that time, the patients are often getting worse. And we do see that this seems to be a trend when it comes to the high-priced diseases or high-priced treatments, moreover, more cost-effective treatments, if I can say that.
Yeah. So which patients in particular that fall within the categories of patients with rare diseases are affected by these delays in paying out?
So we have seen, we've got a very, very big movement at the moment with regards to the cystic fibrosis community trying to access treatments that are available overseas that are not readily available here. And these treatments, the patients that have successfully managed to fundraise to purchase these drugs out of pocket, we've seen significant improvement in terms of their health outcomes. In such a short period of time, it begs belief that medical schemes aren't seeing the value in funding those treatments. We see it happens quite a lot in the lysosomal storage diseases. At the moment, we have actually launched an unprecedented action in the High Court against MediHealth Medical Scheme regarding a 3-year-old patient who has simply been wholly denied any treatment at this particular time, despite it being a prescribed minimum benefit. So we definitely do see it in the conditions that seem to be more expensive to treat, but also where there is a lack of availability in the public sector, simply because of the fact that the prescribed minimum benefits revert back to what's available in the state sector very often. And unfortunately, because these diseases are so rare, you wouldn't anticipate being able to walk into any and every hospital and garner treatment for these things, similar to something like dialysis or even the cancers, where you would have to go to a specialist clinic to be able to receive appropriate treatment. So the whole system really doesn't seem very, very geared up for niche healthcare, if I can call it that. And as a result, patients who are needing to access these targeted therapies are often on the losing side of a delayed judicial process.
Sure.
And the reality is that justice delayed is justice denied.
Who's dropping the ball in this situation, Kelly? With the result that where would we need to start if we wanted to get answers, but also to get the situation fixed?
I think one of the biggest things at the moment, and this is what this Dear Minister of Health campaign seeks to address, is to engage with the minister in terms of him being the custodian, the minister being the custodian and the convener of the Council for Medical Schemes, to plead to provide them with the necessary capacity and resources to be effectively capacitated to be able to do better and improve the turnaround times. I don't think that there's any denial from our perspective that Council for Medical Schemes is the appropriate mechanism to use in terms of adjudicating these disputes and hearing them. However, we need to know that we've got a smooth and efficient process that patients are able to rely on that doesn't ultimately cost them massive degradation in terms of their condition. And we've had patients that have died in the process in terms of waiting for an outcome. So I think if we can get the minister to come on board in terms of capacity, that would definitely be a good start. And secondly, I think we need to have accountability from a medical schemes perspective, and patients need to be better educated in terms of what they are able to access in terms of their medical schemes benefits, and to be able to appropriately argue and advocate themselves to be able to get those benefits fulfilled.
All right, I've got to thank you for your time and your insights here on ENCA. That's Kelly du Plessis. She's the CEO of Rare Diseases South Africa there.